Welcome to this episode of Disease du Jour on the topic of quarter cracks and toe cracks in horses with Dr. Steve O'Grady, owner of Virginia Therapeutic Farrier. The Disease du Jour podcast is brought to you in 2022 by Merck Animal Health. Dr. O'Grady worked as a professional farrier for a decade prior to obtaining his degree in veterinary medicine. He worked in Virginia with Dr. Dan Flynn at Georgetown Equine Hospital for 10 years. Then in 2003, he opened Northern Virginia Equine in Marshall, Virginia, which was devoted to foot disease and equine therapeutic farrier. Dr. O'Grady's practice currently is in Keswick, Virginia. It's a referral practice that provides advanced services in equine podiatry. O'Grady sees referral patients at Georgetown Equine Hospital in Virginia and Palm Beach Equine Clinic in Wellington, Florida. Thank you, Dr. O'Grady, for joining us today on Disease du Jour to talk about quarter cracks and toe cracks in horses.
Thank you for having me, Kim. It's always a pleasure to talk with you.
Well, I always learn so much. It's almost a selfish pleasure when I get to include you on the show. So today, this is something, you have a lifetime of experience as a farrier and a veterinarian dealing with these quarter and toe cracks, and not just in horses here in the U.S., but you have worked around the world on working equids. So in speaking to veterinarians, what's the first thing that a veterinarian should do when he sees a quarter crack or a toe crack in a patient?
Good question, as always. I think we should start off by defining what a quarter crack is. And as you know, the equine hoof is going to have lots of different cracks. It's going to have different areas with defects in it. A quarter crack, or as we consider a quarter crack that is something to be concerned over, is going to be a defect that originates at the coronary band. In other words, the coronary band ruptures or fractures, whatever word you want to use, and then the crack is going to migrate toward the ground. A lot of times you will have surface cracks that go all the way from the hoof all the way up to the coronary band, or you may find a defect at the ground surface of the foot, and perhaps you don't trim the foot appropriately, and that crack is going to sort of migrate up toward the coronary band. So the serious ones are the ones that we encounter most frequently, or the ones that are of concern, are the ones that originate at the coronary band. Now, the toe crack is a little bit different, not quite as common as the quarter crack, but that's going to start right in the middle of the toe. And again, it's going to go ahead and it's going to originate at the coronary band and migrate distally toward the toe. And it's generally going to, which is interesting, it's going to stop probably a short distance from the ground surface. And it doesn't look like that sometimes at first, because when you see a toe crack, you're always going to have a conformation in the front of the foot such that you're going to have a dish or a concavity there. So it's going to have a little bit of a hollow there. So once you trim that toe back properly, you'll see that the crack doesn't extend all the way down to the ground. The interesting thing about the toe crack is that it's movable, and this is what causes the pain. It also causes the problem when you need to go ahead and stabilize it so it will heal. When the horse puts his foot on the ground, puts weight on it, that crack is going to close. When he lifts his foot up, and it makes sense how the foot functions. When he lifts his foot off the ground, it's going to go ahead and open. So there's a little bit of tricks there that comes with repairing them as well. One thing I want to throw out there is that you mentioned earlier on, we've had a lot of experience with working in underdeveloped countries and in these projects where we go to poor countries and provide veterinary care. Very rarely ever see a quarter crack or a toe crack in these countries. Reason being is that these horses, mules or horses, very rarely wear shoes. So having said that, you very rarely see a quarter or a toe crack in a horse that is barefoot. Therefore, it is a function of putting shoes on, how the foot is trimmed, and obviously the job the horse has to do. In other words, the work he's involved in. And you see it a lot more in competition horses because they're having a lot of stress. In other words, they're working at they're working at high intensity and putting a lot of load on their foot.
Okay, and let's talk about, I mean, you kind of started this already, but let's talk about causes. You had talked about the competition horses, and these cracks can be career limiting or even ending in some of these horses. So what are the causes of some of these?
Yeah, career interrupting maybe a little bit of a better word, because when you have a full thickness quarter crack, a lot of times you're going to have full thickness means that it goes all the way into the dermis. In other words, the inside of the foot. This is usually accompanied by bleeding in a lot of these cases. And then obviously if you have a fracture going all the way through, it's moving every time the horse moves. So it's going to cause a little pain. Now, if we look at the hoof capsule that is associated with a quarter crack, I have in 50 years, I've very rarely ever seen a quarter crack that is not associated with a horse with what we call a sheared heel conformation. And what that means is that if you turn the foot around and look at the heel area, or you look at the foot from the back, or pick it up and look down at it, one heel bulb is going to be displaced markedly higher than the other side. In other words, if you drop the line across there, the heel bulbs are not going to be even. One is going to be displaced upwards. When one is displaced upwards, that comes from increased load on one side of the horse's foot. And in the majority of cases, and we always have ones that throw us a little bit of a curve here and there, that horse is going to go ahead and when he walks, he's going to contact on one side of his foot, and then he's going to load the other side. So in other words, he doesn't have symmetric loading. He has what we call asymmetric loading. And then this is where we get into the horse's foot conformation, the farrier and whatever, because unfortunately right now with farrier, farrier is a little bit divisive. So a lot of people have different ideas about the trim or how horses should be trimmed and shod. So the variation sometimes can lead to this abnormality, or this type of hoof conformation. Let's put it that way. When veterinarians look at this, and this is why I sort of strive to provide the information for veterinarians so they have a knowledge of the horse's foot, how the horse walks, what the good conformation, I hate to use the word normal conformation, what good conformation is, what if you know good conformation, then you know abnormal, and how do we direct the cause of something like this, or change the conformation, which we have to in a horse with a sheared heel. So what I'm saying in a nutshell is that I think farriers, or veterinarians need to be aware of the different foot conformations, the different causes of these cracks, horses that how they land, and how this process will lead to some kind of a defect in the horse's foot.
Well, and what you're saying, and if I can interpret this for our veterinarian audience, is that, hey, vets, when you're doing your physical exam, look at the feet. See if there's a problem in the making that you might be able to help the owner and the farrier adjust in order to keep this horse sounder.
Absolutely. I think that's a very good point. Now, let me go to one other point there, that when these horses land asymmetrical like this, and horses that have a marked sheared heel or displacement of one heel bulb there, that is basically driven by the horse's conformation. And if you have a horse, for example, with a narrow chest and his forelimbs are rotated laterally, what we call rotational deformity, that horse is going to break over such that he moves toward the outside. And then when he goes to accept weight, his foot's going to come in on an angle. So he's going to contact on one side of the foot, and then he's going to load on the inside. Depending on the foot conformation and the farrier that's involved is going to give you the intensity of how much he's going to overload one side of the foot. When you overload the side of the foot that is being displaced, this continuous repetitive overload is what's going to lead to a fracture or a quarter crack or something on that order. And if we reverse this process, then that's going to start our treatment process. I don't want to. One of the things we do is we want to go ahead and right away we want to go ahead and we want to repair this crack. And a lot of times, especially owner pressure is going to dictate that, we need to work this horse now. We want some kind of repair on here, and then we'll go about our way. My thought process there is I'm more interested in what's causing this. Let's take the cause away. Let's direct the cause. Let's discuss it. Let's change that. And once you change the farrier, you change the conformation of the hoof capsule, this crack or defect, crack, whatever you call it, is going to start to heal without putting anything on it. So I'm always at the, my philosophy is let's go ahead and attack the cause of it rather than just put a Band-Aid on it for a period of time when it will go ahead and reoccur. And when it reoccurs, you have to remember that every time it reoccurs, you get more of a scar in the lamellae. The attachment of the hoof capsule to the bone. So each time it fractures or it opens up, you're going to get more scar tissue in there. So it's going to make the horse more prone to opening up. One thing I want to say by my sort of races forward is that you still hear in the farrier world that this horse, it's landing asymmetrical. It's not landing flat. Well, that conformation of the horse is dictating, his forelimbs is dictating how he lands. You cannot change that. You can adapt, you can maintain it, you can improve the landing, improve the hoof capsule, but you can't make that horse land flat. If you do, then you're defying his conformation.
I think that's worth saying again. So many people want to fix that. So say again, if you have a horse that's not landing flat, you can help it. You can help adjust it. But if you correct it too much, you're causing.
Yes, then you're defying his conformation, and you're creating more. you're creating more problems. In other words, his limb, the way he moves forward, if his knee is rotated toward the outside, that's the way his breakover is going to be on his foot. If his knees are straight, he's going to land flat. If he's rotated inwards, he's going to load the other side of the horse's foot. In other words, if he's got a toe-in conformation. So it's really important not only to look at the hoof. The hoof is going to tell you when you have a hoof capsule distortion, we have to remember that we have excess load on one section of the foot over time that's creating that distortion. Therefore, we look at the horse's feet, we look at the horse's conformation, and then we always take a few minutes. Let's watch that horse walk. How does he land? Does he land flat? Does he land heel first? Does he land toe first? Does he land asymmetrically? In other words, does he land on one side of his foot and then load the other side of his foot? And again, it's mostly dictated by conformation.
However, and you and I have talked about this before, and I just bought, bless his heart, an 11-year-old quarter horse gelding who had a, say, less than O'Grady style trim that has such a long toe and such a low heel that it's going to take me probably 3 trims to try and get him back. So not everything is conformation. Sometimes it is caused by the farrier.
Well, I am a farrier, and I'm very reluctant to say, it's the farrier's fault. Let's look at this together, vet farrier, or you usually need to have some discussion with the farrier. Have a discussion rather than placing blame. Let's look at it. Here's what we have. Now let's go ahead and move forward and fix it. And you can fix these. It's not something that you have to keep putting a patch on it.
Today's Disease Du Jour podcast is brought to you by Merck Animal Health, the maker of prestige vaccines, Banamine, Panacur, Regimate, Protozil, and other trusted equine health solutions. Merck Animal Health works for you and for horses. Learn more about Merck Animal Health's comprehensive portfolio of products, as well as their unconditional investment in our industry, profession, and community through programs such as the Respiratory Biosurveillance Program, the partnership with Equitrace, which delivers secure, streamlined record keeping and instantaneous temperature measurements when coupled with Merck Animal Health biotherm microchips. Visit merckanimalhealthusa.com for more information. So what is the bad thing about patches? I mean, I've seen a lot of racehorses with patches on their feet. Seen a lot of performance horses. So why is it that you want to try and correct the initial problem?
There's as many different methods of patching horses, and it's fun. We all like to do it. There's as many ways to patch a quarter crack as there is quarter cracks, and that's a quote from Dr. Bill Moyer, a great friend of mine who has done as much work on quarter cracks as anybody on the planet. And it creates a Band-Aid. It takes the movement away, and sometimes it presents it gives the misguided thought that, okay, we have stabilized this thing, now it'll grow out, but we still have the cause underneath there. So when it grows out, and I've seen it, dozens and probably hundreds of times, when it grows out, what happens is that the horse go, oh, look at it, boy, this worked out great, and a couple months later, it breaks open again. In other words, we see so many recurrent quarter cracks, and so many that I get are quarter cracks that have been patched, they've been treated and whatever by different people, and then they keep reoccurring, and they sort of land in our backyard. And each time a quarter crack opens up or ruptures again, you get that increased scar tissue in there. In other words, you don't have that good, viable, flexible lamellae that is attaching the hoof wall to the bone. Therefore, you got a scar now, so it's going to be more prone to reoccurring. Yeah, that's of course the bane of anybody that's ever had a quarter crack, is that getting rid of them is hard. Yes, yeah, and they're all driven by overload. There's no doubt about that. I mean, that's logic as well. Let's move around the hoof to toe cracks. And honestly, a lot of horse owners, when veterinarians are going to be talking to them, they'll say, oh, he chipped his toe and got a crack or whatever. And yeah, there are surface cracks. Yes. But the ones we're talking about are the ones that originate in the defect in the coronary gland and work down. Right. And again, these are going to be related to conformation. And again, it's got to be usually pretty severe conformation. And in these will occur in 2 cases. Number one, with the horse, as you described earlier on, with the exceptionally long toe and the low heel. That means that your heel has moved forward and you have less ground surface back there, but the long toe has created leverage. And the longer that toe is, that when that horse goes to break over, it puts a lot of pressure on the dorsal section of the foot, and the focus of the pressure is at the coronary band. And again, this leverage and this pressure over time is going to go ahead and it's going to stress the tissue to such a point that it's going to go ahead and it's going to open up. The other scenario here is the club foot. And it's interesting here with the club foot is that when you have a true club foot, that means if you look at a radiograph, the joint is flexed a little bit. So that means you have a shortening of the deep flexor tendon behind, not to get too involved in that. But what happens is that you have, you're growing excess heel in the back, and you're growing less toe in the front. So the front of the foot becomes very steep or upright. And with a low-heeled horse, you're putting the weight bearing back toward the heel area. When you have a horse with a club foot, you're putting excess weight bearing on the toe. So now you start to overload the toe. That wall from the overload, those horn tubes will start to bend. You start to get that concavity in the front of the foot like you see a lot of times. And then you go to the point where, okay, we've stressed these tubules enough, so now they break. And you have a crack at the toe. Now, and it makes sense when you lift up the horse's foot, the hoof capsule, the hoof contracts. So this opens the crack at the coronary band. And then when you put weight on the horse's foot, the heel area is going to expand. And now think about it, as the heels expand, it goes ahead and closes that defect at the toe. You can demonstrate this to yourself. And that becomes a little bit important, noticing that or understanding that when you go to repair it. If you're going to get to the point where you have to stabilize that or patch it or whatever you want to call that.
So we've talked about some of the causes and how you can look at the foot and figure out the conformation and the causes of it. We've talked a little bit about treatments, but let's talk a little bit about veterinarians working with farriers. How, and you mentioned before, we all have to be professional. So how do you work with farrier? If you have someone like me who just got a horse that probably needs some attention from the farrier so it doesn't cause these issues. Or if you have a horse that you see the beginnings of maybe the dish or some other conformation that maybe is being a little addressed, maybe a little too hard. So what do you do? How is a veterinarian?
Yeah, that's a really tough question, and it's one that I know you've worked on a lot. The different relations between the two professions, which is so very important. And it comes down to two parts, I think. Number one is respecting each other. And being a farrier, it's hard work. And there's all different levels of knowledge and skill and experience and whatever on the farriery side. The same thing goes for the veterinary side. We're not leaving the veterinarians off as well. And if you have a veterinarian who's a reproductive specialist, well, he doesn't spend a lot of time looking at the horse's feet. Neither does a sports horse medicine veterinarian. He doesn't spend a lot of time looking at the reproductive tract. So, you have to have, on the veterinary side, you have to have somebody that has interest in that section of the horse's foot. And I think whether it starts at veterinary school or whatever level is, we have to have more interest on the veterinary side in farriery. So the two professions can have a good, productive, educational discussion between rather than the veterinarian leaving a note on a sandwich bag in the barn for the farrier and say, hey, here's what we want to do that he read out of a book or whatever, and the farrier picks it up and he tosses it to the side and, well, this is what I do with it. Instead of having a cup of coffee, meeting together is a great thing at the barn, and then discussing it, and I think it's on the veterinary side to take more of an active role here and say, look, let's look at the cause of this thing. And if they understand foot conformation, then they can go ahead and if you know what's wrong, you can always take the procedure and reverse it. And that's what we want to do as far as treating it. So it comes down to respecting, the profession on either side, whether you agree or not. Put your egos in your back pocket, leave it at the door, and meet up with somebody with a nice discussion. And, well, doc, this is the way I fix it. Oh, okay. But you ever think about while you're doing that, maybe we could also incorporate this. So in other words, it's a give and take, and as much as respect, the other word is communication. Of talking between the things. And there's not enough of that goes on. And you have to admit, you've seen it, we've all seen it. There's a lot of hostility between the professions, and it doesn't have to be that way. It certainly doesn't have to be that way.
No, there is so much that each has to offer. And I have worked with some amazing vets and farriers who have learned a lot from each other.
Absolutely.
On how to help horses. And that's the bottom line. I think both professions, that is their goals, is to help horses. So, I think, as you just said, in order to help the horse, they need to communicate and respect each other.
Yep, I think that's so important. For example, I put I think 3 or 4 farrier days on an AAP, and whatever we could do, we even through parties we gave stuff away, and we weren't able to attract very many farriers there. On the other hand, I spoke at the International Hoof Care Summit last January, and I could count the number of veterinarians there on one hand. So it seems like the veterinarians, have their continuing education, and the farriers have theirs. On the other side, we still don't have a way of getting them to meet in the middle. And there's been some clinics that have done a nice jobs of getting something like a Root and Riddle and a group in Florida and a couple others. You're basically just addressing a few people. How many people can you can get into one of these seminars? I've done farrier seminars all over the country, and we'll get 50, 60, 100 people there. Well, I mean, you got 40,000 farriers throughout the United States. So we probably need more of some kind of way of reaching both professions and bringing them together. But my focus in the last couple of years is to address veterinarians. In other words, take the farrier or take the lameness farrier, foot disease, foot problems, to the veterinarians. Hopefully, with them gaining knowledge of the horse's foot, they can better communicate with farriers. If that makes sense to you.
No, that is perfect. And one of the reasons that I love to have you on the show. So is there anything else about quarter cracks or toe cracks that you want to, and I know that there's books written on this and you could lecture on this for days on end, but just in this brief podcast that you can suggest to veterinarians?
Yes, let me address that, and something that I've been interested in a couple of years, quite a few years, and been doing regularly now for the last few years, is when I run into a quarter crack. And I've always had the luxury of dealing with high level horses, which we see most of the time. And with these good horses, owners will take the time with them. And what I try and do with all the horses is I want to take their shoes off, and I want to leave them barefoot for a period of time. And that can be either 10 days, 2 weeks, somewhere around there. People have got to be reluctant. Look, doc, what are you talking about? This horse has to jump on Saturday night. You're telling me to take the shoes off. Well, I want to do what's best for the horse. And we have now case after case documented where we'll take these shoes off. We'll just trim the horse's heels until everything's on the same plane. In other words, the frog and the hoof balls on the same plane. So we're making the section of the horse's foot, the palmar or heel area of the section of the horse's foot, what we call load sharing, and then we'll leave the horse's foot. We'll leave the horse without shoes. Let him walk. Let him go out through the country, whatever. And in 7, 10, 14 days, you can take a picture before, you can take a picture after. That heel that's displaced will drop down, it will move outwards, the heels will relax, they'll come down, and the conformation will improve probably by about 50% in that small period of time. Now you have almost a new, wow, we have a revamped area in the back of the horse's foot, and now we're going to go ahead and be able to better apply our farrier, or leave it barefoot if you want it, but apply our farrier, because we have a whole different section there. And then we trim the horse's feet, as we do with all the horses. We look at the middle of the horse's foot, and then we trim the horse such as we have proportions on either side there. Something we've published and lecture on over the years. With toe cracks, let's not get too involved there, but the whole thing is change the horse's foot conformation. In other words, stop the loading pattern. And in other words, change the loading pattern. And that means that we trim in such a way, and it all begins with the trim. We've talked about this before, as you know. And once you have trimmed, by trimming the horse's foot appropriately, heels or toe, what you're doing is you're redistributing the weight on the bottom of the horse's foot. That is the way you address any of these hoof wall or hoof capsule defects.
Perfect. Now, and I think that is a great piece of advice to end on today. So thank you, Dr. O'Grady, for joining me on this episode of Disease du Jour. And we want to thank all of our listeners for joining us, and a special thank to our 2022 sponsor, Merck Animal Health. And we invite everybody to go back and listen to some of our other Disease du Jour podcasts. So we even have had Dr. O'Grady on before. And if you have any questions or suggestions, you can send an email to me at kbrown, that's the letter K Brown, at equinenetwork.com. Disease du Jour is a production of the Equine Podcast Network, an entity of the Equine Network, LLC.